Good morning, everybody. Today, some. Let's discuss a very important disease of gastrointestinal tract, and the Barrett's disease. This is not so much common, but this is important in the way that this is most common in white males, typically between the age of 40 and 60 years. This disease is so what is the Barrett's disease? Barrett's esophagus. So Barrett's esophagus, this is the complication of chronic gastroesophageal reflux disease. So what is the gastroesophageal reflux disease? Gastroesophageal reflux disease, this is the disease in which the gastric acid is regurgitates into the lower portion of the esophagus, and due to the continuous exposure of this gastroesophageal junction with this gastric acid, there and if it is not treated, so in chronic condition this may lead to some metaplasia and dysplasia, but you must know that most of the people having this gastroesophageal reflux disease, they don't have this dysplasia. It occurs only in 0.2 to 2% individuals each year having this gastroesophageal reflux disease, and also so this is the Barrett's esophagus is a complication of chronic gastroesophageal reflux disease, and this is characterized by the intestinal metaplasia within the esophagus squamous mucosa. So the esophagus is so columnar epithelial. Later I'll discuss which changes you will see in this. So, and Barrett's esophagus occurs in 10% of the individuals with having symptomatic gastroesophageal reflux disease. So what are the symptoms your patients complain when? So your patient will tell you that your patient is having some chest pain, some burning sensation, like this, your patient, and after you will There are so many procedures I will discuss you, so you will identify how you diagnose. So this is the so and the greatest concern of this Barrett esophagus is the uh, adenocarcinoma. So in 0.2 to 2% of individuals each year. So this is not so much common, but once there is adenocarcinoma. So in how do you know that this? So in biopsy and some endoscopic surveillance, you will observe that there are some mutations observed in the uh, biopsy, and this confirms that these mutations lead to some metaplasia and dysplasia. So what is the metaplasia? So metaplasia is the reversible change of one type of cell into another type. So in this Barrett's disease, say in this Barrett's disease, uh, the normal long columnar epithelial linings of normal esophagus. This is the gross picture of normal esophagus. So the normal lining of the columnar epithelium is in microscopic picture. You will see that it will change into another types of cells like goblet cells, mucous cells, etc. I'll tell you what changes you will see. So okay, and grossly you will see that these lining, these columnar epithelium are extending up from digitally from the gastroesophageal junction. So based upon how much these are extending up from the gastroesophageal junction, this can be long segment or short segment. So for 3 or more than 3 centimeter, you can say that this is a long segment dysplasia, and if less than 3 centimeter, you can say that this is short term dysplasia. So grossly you can identify this. Yeah, and so in the gross picture you will identify this. And so before I discuss you what are the microscopic changes, let me just tell you so what are the etiology of this Barrett esophagus. So presence of dysplasia, pre-invasive change which is associated with prolonged symptoms of gastroesophageal reflux disease, and longer segment length 3 centimeter or more than 3 centimeter, and increased patient's age is also in all, like typically between 40 to 60 years of age, and it is more prevalent in the whites and males. So typically between age of 40 and 60 years. Okay, and in 10% of individuals having symptomatic gastroesophageal reflux disease, this will result into Barrett's esophagus. Okay, And Barrett's esophagus, it is a chronic um, gastroesophageal reflux disease, and some characteristic changes what I have already told you is observed in this. And so yeah, and if it is chronic, so in 0.2 to 2% of individuals having gastroesophageal reflux disease, it will lead to the adenocarcinoma, and this adenocarcinoma is the greatest concern of Barrett's esophagus. So yeah, and Barrett's esophagus is also more common in Caucasian and patients with old age, but it always does not develop into esophageal tumors. So yeah, in gross picture I have already discussed, so let me just discuss what will you see microscopically. So let me just show you. So in microscopic picture you will see that some goblet cells are these are the goblet cells which have replaced the normal columnar epithelial lining of esophagus. So numerous goblet cells you are seeing, and also here hyperchromatism you are seeing, and here you can see that mucus vacuoles, these are the mucus vacuoles, and okay, mucus vacuoles, and you will also see some gastric alveolar cells. So and but presence of alveolar cells are whether it is sufficient for diagnosis of Barrett's esophagus or not is still controversial. So just based upon presence of numerous goblet cells and gland within glands and some gross picture endoscopically, based upon symptom you can't tell that it is Barrett's disease. So you'll mainly have to perform the endoscopy and some biopsy and then microscopic observation, then you will confirm. So and and in let me discuss something more. So dysplasia in Barrett's esophagus is classified as low or high grade dysplasia. So what is dysplasia basically? So dysplasia within a tissue, if you say the presence of abnormal cells, uh, in abnormal in the sense of it will be having abnormal shape, and also number might be more than usual, like in Barrett's disease, there are abundant number of goblet cells, and some abnormal cells like columnar epithelium has modified into um, these columnar epithelial lining cells. These will modify into itself goblet cells or mucous vacuoles, uh, and this foveolar cells, and some other, and so and here you see the dysplasia in the Barrett's esophagus. This is this is the microscopic picture of Barrett's esophagus of low grade dysplasia. In low grade dysplasia, you are seeing that here the nucleus-cytoplasmic ratio of this columnar epithelial lining of the esophagus had changed. So here you are seeing increased size of nucleus in low grade dysplasia. And in low grade dysplasia, you can also see here the hyperchromatism. So dark blue colors you are seeing, these are the nucleus which are stained dark blue color here in using and hematoxylin staining. So this is the low grade metaplasia. So what do you mean by now high grade dysplasia? So in high grade dysplasia, here metaplasia is also there, but we are talking about dysplasia. So here you are seeing that gland within gland, goblet cells within goblet cells, and so condensed, so many nuclei are there, and number has also increased, and you can't identify this. This is the abnormal microscopic picture of the esophagus. So even this is very difficult to identify if it is the microscopic picture of esophagus. So this is very high grade dysplasia. So what are the characteristics of high grade dysplasia? Here the frequently and severe abnormal cells are present in this high grade, and this is in high grade you will see through endoscopic surveillance you will observe the budding, and so many irregular shapes are there. So here, are you seeing any columnar epithelium? No, there is no columnar epithelium. So this is high grade dysplasia in Barrett's esophagus. And so after identifying all these things, So what are some? I have already told you that um, based upon the symptoms, you can't just identify that this is the Barrett's esophagus. You'll have to perform the biopsy and endoscopic surveillance, and after you are sure that this is a Barrett's esophagus, so you'll need to do some treatments. So in this some surgical interventions are required, like if it is severe, then you esophagectomy can be done, and or if not so much severe, then a part of the affected part of that gastroesophageal junction or some lower portion of esophagus can be surgically removed. And after this but there are some other procedures also in case if it is not so much severe and such intensive surgery is not required, then you can do some mild surgical resection and also some laser ablation. So in this procedure you are using electrical current, you are generating some heat, and then you are destroying the fast growing metaplasic cells and dysplasic cells in case of a high grade dysplasia, and some endoscopic microscopy is done. So and also some photodynamic therapy is done. In this you are giving some drugs which can be activated by the endophotoscopy, and after that these drugs will start killing those tumor cells and those dysplasic cells, and in future some chemopreventive measures will also be done. So research is ongoing. So so in this video we discussed about what is Barrett's esophagus, what are its etiologies, and we also discussed some pathologic changes. In gross picture we have seen the long segment and short segment. Long segment if it is 3 centimeter or more, and short segments for less than 3 centimeter. And in microscopic picture we have seen the some metaplagic cells like goblet cells, mucus vacuoles, and foveolar cells, and in low grade dysplasia we have seen the hyperchromasia and the epithelial cells, the columnar epithelial cells do not mature at their site, and they migrate through endoscopy we will observe this, that these cells will migrate to the surface and they will not mature there, and some nucleocytoplasmic ratio becomes high, and so in hematoxylin and eosin staining, you will see the dark blue color of the nucleus, and the nucleocytoplasmic ratio has increased in low grade dysplasia, while in high grade dysplasia you will observe many cells having so many abnormal sizes, so many abnormal shapes, and number has also increased abundantly. Hope you all enjoyed this video, and visit facebookuniversity.com for more interesting videos relating. Hope you enjoy this. Thank you. Thanks for watching.